Wisconsin suicide rates are higher than the national average, and over a 5-year period, suicide rates in our state increased 15%. Suicide devastates urban and rural communities and the families and friends left behind. Prevent Suicide Wisconsin is a statewide public-private partnership working with organizations across our communities to provide hope and resources to prevent suicide. We are joined by Erica Steib, the State Suicide Prevention Program Manager for Mental Health America of Wisconsin, which manages the Prevent Suicide Wisconsin program. Thank you so much for being with us.
Yeah, thank you so much for having me.
How does Prevent Suicide Wisconsin work with local communities to reduce death by suicide?
Yeah, so Prevent Suicide Wisconsin, PSW, we are tasked with bringing resources, knowledge, education, training, and facilitating collaboration with different leaders in different sectors all around the state, because we really believe that there's a role for suicide prevention among all different sectors and settings. It's not just something for mental health professionals, although, of course, that's a part of it. So we work with a variety of partners throughout the state, especially local level suicide prevention coalitions that exist in almost every county in the state. And they are working on a variety of different programming. It can look a little different from place to place, but we do our annual Prevent Suicide Wisconsin conference to try to bring folks together, share best practices and learning together. We do an annual training for healthcare organizations called Zero Suicide. And we update the state suicide prevention plan usually every 5 years. And we just actually came out with that a couple weeks ago at the start of September. And this plan provides data and best practices, and the local coalitions use it to inform their work so that they're moving in a strategic direction along with the rest of the state.
What are some of the factors that contribute to suicide? And by knowing those factors, how does that help us to prevent suicide deaths?
Yeah. So suicide is obviously a complex issue. There's a lot of factors. There's not just one cause, and there's not just a one-size-fits-all approach to prevention either. Suicide, mental illness is sometimes part of it, but only for about half of suicides, actually. Other risk factors include like relationship issues, financial stress, job loss, like dealing with the legal system. These more like life circumstances kinds of events, as well as experiences of trauma and violence and oppression for certain groups. So all of that can play a role in suicide. And, we've also seen this increase over the last 10 years. And we also know there's just a lot of hardships and stressors on people at this day and age, especially around like economic stability. As I saw a statistic recently that only 25% of those polled American residents actually believe that they have a future and have upward mobility, which is huge. I think that says a lot about what people are feeling and the hopelessness that people are dealing with. So there's a lot of different factors, a lot of different stressors.
Are there some parts of Wisconsin where death by suicide is more prevalent?
So in Wisconsin, we see a disproportionately high rate among rural communities compared to urban. And so that means that there's like less concentrated amount of people there, but they are dying by suicide at a greater rate that's disproportionate to like the population that they represent.
And are there demographic things that we notice as well about who is dying by suicide?
Mm-hmm. Yeah, so we see that males die by suicide at a far greater rate than women in this state. When we look at the five most recent years of data, we see that Native Americans in Wisconsin have a rate of suicide that is far higher than the average for the overall state, as well as we see a greater rates of self-harm among American Indian as well as Black residents in the state as well.
One of the things that your new report does is it really talks about the importance of increasing social connectedness. as a way or an important factor in preventing death by suicide. Why is that so important?
Yeah, so people naturally turn to those closest to them when they're going through a hard time, right? Like their friends, their family, maybe colleagues, maybe teachers. Those are those like natural supports, right? And so social connectedness and building like strong communities and confidence in people and being able to talk about suicide with others is an important aspect of prevention because it's just the most natural for people. And connection and feeling like you have a sense of belonging is one of the greatest risk or greatest protective factors against suicide, is feeling like you have that support available to you and that you have people you can turn to. And so that's why, yeah, there's a lot of fear around suicide. There's a lot of stigma. People tend to assume that it's something only for like mental health professionals to talk about. But that's not true. Everyone has a role to play and can help create safety by connecting with others.
And is listening a big part of that? Just listening to someone when they're telling you about how they feel, and knowing that if someone tells you that they are considering suicide, you need to take it seriously.
Yeah, absolutely. Yeah. And it's, sometimes it's the simplest things that can make the biggest difference. And also sometimes the simplest things are what's hard for people. Yeah, because I think that listening and really being able to slow down and ask someone, what's underlying these feelings, and really like having an in-depth conversation about that, talking about what help means to them, can make a huge difference. Because I think often people really want to rush into like fixing people's problems, and of course everyone's afraid of like saying the wrong thing. But I think everyone needs to work on, those little barriers like in ourselves and find ways to slow down and to give people the space to really talk about what it is they're going through.
Erica, thank you so much for the work you're doing. We really appreciate it.
Yeah, thank you so much.
More information is available at preventsuicidewi.org. And if you or someone you know needs help right now, please call or text the National Suicide and Crisis Prevention Hotline at 988. You can also chat live with someone now at 988lifeline.org. Someone is there to help. Thank you all so much for being with us this week on Connect MKE. Be well and take care.